Hello everyone, let's start our next questions. So our first question is here. Which of the following kids should the nurse recommend for additional testing when evaluating speech development? Option 1, a baby who is 4 months old and giggles. 2, a 10-month-old who can pronounce dada and mama. 3, an 18-old who utters just the word no. An infant of 1 year old who speaks 3 to 5 words. So firstly we will grasp this question, that what the question is actually asking here. So basically, like nurse recommended for additional testing when evaluating the speech development in the children. So now we have to select the right option here. So how to solve this option? Before solving this, we have to know like what kind of speech and hearing development in the children. So here we know some children's like infants, like 0 to 1 year infant, then 2 to 3 year are toddler, then are the preschoolers and schoolers. So here with the help of this chart we can see like 6 months to the 1 year old child can babbling. He can be recognize names like 1 or 2 words, mama and dada. 1 to 2 years follow the basic commands and point to the body parts, and in the speech development you can see here they can speak the 20 to the 50 words and put 2 words together. Now 2 to 3 year old, they make 2 to 3 word sentences and understood by the family, means the speaks like 2 to 3 words understood by the family. And 3 to 4 year old intelligent to the most sentence with 4 or the more words. So these are some basic speech development according to the age. So we know here like the basic techniques of the speech disorders. So we know if the 6 months, then he can giggles or 2 words like 1 to 2 words like mama and dada. Then 1 to 2 years he can speak 20 to the 50 words and put 2 words together. And 2 to 3 years to like he or she can make 2 to 3 word sentences actually that understood by the family, and intelligent to the 3 to 4 year intelligent to the most sentences with the 4 or the more words. So these are some basic speech like the technologies or the developments in the children. Now here how to select the right option here. So we know first option is right, a baby who is 4-month old giggles. So this is the right option here because according to the speech development in the according to the age, this is the right option. A 10-year-old month can pronounce dada and mama. This is also the right option here because we know that the 6 months to the 1 year child, he can speak 2 words like dada mama. So this is also right option here. Fourth, an infant of the 1 year who speaks 3 to the 5 words. This is also a right option here because we know like 1 year old children can speak 20 to the 50 words. So now only the third option in which there is recommended for the additional testing while evaluating the speech development. Because why the 3 option is right here? Because an 18-month-old who utters just the word no. Because 18-month-old means 1.5 year old child. So he or she can able to make the sentences like 2 to 3 sentences that understood by the family. So here this is not the appropriate option here, because if a 18-month-old child who utters just the word no, then there should be always a recommendation for the additional testing when evaluating the speech development. So this is why the option number 3 is the right option. So this is the basically, now just summarize this question rational in 2 minutes. Like a youngster should be able to say 10 or more words by the age according to the 18 months. So we know like he will not able to speak out the like 10 words, so it can lead to the developmental delay. So we know this is the developmental delay condition. We can call it the lack of speech development or hearing impairment or the lack of the social stimulations. So that is why the 3 option is the right option here. Next, question number 2. After bringing the infant home, a family was informed by the pediatrician that their daughter's phenylketonuria levels were excessively high. Phenylketonuria was determined to be diagnosed after the additional testing since no one else in the family has a condition. Sorry for the interruptions. So, phenylketonuria was determined to be diagnosed after additional testing since no one else in their family has a condition. The parents don't want to accept the finding. The nurse should describe the illness as option 1 has no effect on the family ability to conceive in the future. It's brought on by a recessive gene that either parents contributed, is treated by removing the protein from the children diet, and is passed down through the recessive genes that the parent contributed. So here what is the question asking actually here? The condition given is the phenylketonuria, and according to the parent's statement, they state that no one else in their family has this condition. So they don't want to accept the finding right now here. So how the nurse would describe the illness, like how she will explain the illness to their to the parents of the child. So let's solve this question. So firstly we have to understood about the phenylketonuria. So we know phenylketonuria is a genetic condition where level of phenyl buildup in the body is left untreated, and phenylketonuria can affect a person's cognitive development. Treatment with medications or dietary changes to help the reduce symptoms. So this is the basics about the phenylketonuria. So basically if we explain it, so we know it is a birth defect, in the newborns, and how it occur basically. So we know it occurs due to the mutation in genes that help make an enzyme called phenylalanine hydroxylase. So this is actually the definition of the phenylketonuria. Okay, so what is it? Actually it is a genetic condition where the level of phenylalanine build up in the body, and if it left untreated, phenylketonuria can affect the person's cognitive development. So how we can treat it? Like with some dietary changes, like we can reduce the amount of the protein diet or amino acid diet in the child's life pattern. So here we know this like you can see here, each parent's recessive gene carry a recessive gene for the phenylketonuria, and this is actually illness. A newborn acquire a recessive gene from each parents in order to pass it on the child. So all the protein contained food like amino acids should be reduced. It cannot be deleted from the diet, but we can reduce it. And some condition regarding to it, this is a sickness that we can manage it, but we can't cure it. And there is 25% possibility of a child with the inherit the illness from the each pregnancy. So this is the basics like the rationale for the disease here. And we know here some facts, like it's caused by the mutated gene that I have explained you, phenylalanine hydroxylase. Due to the defect of it, we can call it the phenylketonuria, and basically this enzyme is located on our chromosome number 12. So you can see here this enzyme is located on the chromosome number 12. So that is why it is a genetical disorder, and it is basically due to the recessive gene from the each parents. So we know here like recessive gene for the each parents, and that is pass it on the child. So here this is the whole about the disease condition phenylketonuria. Now let's solve this answer here. So obviously the fourth option will be right option here, that is passed down through the recessive genes that each parents contributed. So this is the rationale of this, like each parent's recessive genes carry a recessive gene for the phenylketonuria, and which is a disease, and newborn acquire a recessive gene from the each parents contributed in order to pass it on the child. So fourth option is right option here. Option 3 is inappropriate, like is treated by removing. So we will not remove the protein, but we can reduce from the diet. And it brought, so it not brought, it has passed down recessive genes, and has no effect on the family ability to conceive in the future. So it is a disease condition that is a, we can cure it, but we cannot treat it. So this is the rationale here, this is the right option here. Now we will move to the next question. During a postpartum checkup, the mother of 2-week-old baby sobs to the nurse that she is exhausted and feel like a bad mother to her child too also. And